Infectious Disease Reference Guide for Designated Officers, Section 1, Introduction. The role of the Emergency Service Agency is to set standards of practice, provide training and appropriate resources, like personal protective equipment. Appoint a designated officer and alternate. Assess occupational risks. Complete Workplace Safety and Insurance Board forms as required. Notify the health unit when the new designated officer is appointed. Notify the health unit when the contact information for the designated officer changes. Emergency service workers need to be aware of occupational exposure risks and take appropriate precautions. Minimize and/or prevent exposures using routine practices and PPE. Comply with workplace health and safety policies and procedures. Report possible exposures immediately to the designated officer. Designated officers receive and document reports of possible ESW exposures. Notify the health unit if exposure has occurred and provide details of the exposure. Notify ESW if health unit reports possible exposure to designated officer. Assess risk with ESW to determine if exposure has occurred. Use this manual to provide initial post-exposure recommendations to ESWs. Relay additional health unit post-exposure recommendations to ESW as applicable. The health unit assists designated officers in assessment of possible exposures. Provides recommendations for follow-up after ESW exposure occurs. Acts as a resource for information and education on infectious diseases and prevention. Provides recommendations for minimizing exposures to infectious diseases. Follows up on all confirmed cases of reportable infections as per protocols. Performs contact tracing for people exposed and confirmed cases of reportable infections. The health unit does not gather information from the ESW. That's the role of the designated officer. Provide specific treatment recommendations. That's the role of the ESW's healthcare provider. Provide information on the diagnosis of a patient. That's confidential health information. There are two methods of notification. The ESW notifies his or her designated officer of the exposure. The designated officer then notifies the health unit of the exposure and provides details of the occurrence. Or the health unit identifies an exposure that occurred during the course of an ESW's duties and notifies the designated officer at the facility where the ESW works. The designated officer then notifies the ESW. In both cases, the designated officer acts as the liaison between the health unit and the ESW. Contact information. During normal working hours, Monday through Friday, 8:30 a.m. to 4:30 p.m., a communicable disease control nurse is available through your local health unit office. After hours, call 1-888-255-7839 for a reportable disease, exposure, or outbreak. Call 1-800-268-6060 for chemical spills. Or call 1-888-255-7839 for an animal bite, rabies vaccine, or environmental contamination.